Hopefully all of you are fine. Now my next slide is about the depression treatment with digital therapeutics. Digital therapeutics are an emerging healthcare technology and the treatment methodology that often also includes a support from the remote clinicians. Digital therapeutics utilize digital solutions to change patient behavior and lifestyle, usually with the help of a smartphone and delivered through an app. Digital therapeutics have been successfully used to treat many chronic diseases like type 2 diabetes, obesity, and depression. Digital therapeutics can either be standalone, only an app for online material, or sometimes even chatbot augmented or supported by a remote healthcare professional, in some cases, also health coaches. A digital therapeutic solution for depression, remote licensed therapists can monitor patients in real time and getting the patient daily mood and bi-weekly depression questionnaire results to a dedicated network of the therapist in easy. The mobile application prompts the patient to complete a symptom questionnaire. After completing the questionnaire, the data is instantly uploaded onto a clinician dashboard that is used for the patient monitoring. The dashboard shows results in a clear and easy to understand manner. The whole process takes only a couple of minutes and the therapists always have up-to-date information on how their patients are doing. Here you can see 10 day ago, mood, PHQ-9, contacted and last seen. Depression treatment with digital therapeutics. Real life digital therapeutic solutions and result. Mary Health is showing extremely promising results with our digital therapeutic solution for depression. In a real world data set of the 141 people who started on an 8-week treatment program between March and December 2017, 86% completed it and only 14% drop out. 75% of people experience at least a 20% reduction in the depressive symptoms, and 50% of patients had their symptoms reduced by 50% at 3 months from the start. In traditional treatment with antidepressants, roughly 46% of the depressed patients achieve 50% symptoms reducing during average time of 3 months. Also, around 50% of patients quit antidepressants prematurely. List of depression apps are Moodpad Depression Anxiety Test. You can also download it on your Play Store, Talk Life, Mood Tracker, Yopper, Depression ZBD, WhatsApp, not WhatsApp, it's WhatsApp. Okay? Pacifisa and the Happy Fi. Thank you so much, students, for watching it.